Good morning. I stand before you not merely as a scientist, but as someone who has witnessed what happens when we promise a silver bullet for human suffering, only to discover that the bullet comes with its own cartridge. Today, I want to speak plainly about a phrase that sounds irresistibly right: free healthcare for all. It resonates with our highest aspirations. It promises dignity, safety, compassion, and yet, it is not the complete answer. When we speak of free healthcare, we invoke one of humanity's most compassionate dreams, the idea that no one should be denied care because they cannot pay. It sounds noble, moral, almost sacred, yet in the real world there is no such thing as free. Everything in healthcare, every syringe, every MRI machine, every nurse's hour, every vial of medication carries a cost. When that cost is removed from the patient's bill, it does not vanish into thin air. It simply shifts elsewhere. Governments absorb it, taxpayers sustain it, and systems strain under the weight of universal demand. What begins as an act of mercy can, if poorly managed, become an act of quiet neglect. When the numbers no longer balance, hospitals ration care, doctors burn out, and waiting rooms fill with promises that cannot be kept. The word free deceives us by hiding the complexity of what sustains medicine, human skill, scientific progress, and material resources, all of which must be nourished, not merely distributed. Free healthcare, as a slogan, appeals to our moral instincts, but in practice, it often collides with economic and logistical reality. When everyone is entitled to everything at no direct cost, consumption rises, not always out of need, but sometimes out of convenience or fear. Systems become overloaded, and decisions that should be made by physicians begin to be made by administrators. The quality of care starts to bend under the pressure of quantity. What was meant to equalize access can end up equalizing mediocrity. You see, the problem is not the intention, it is the execution. The moral case is clear. No one should suffer for lack of treatment. But the practical case requires discipline, efficiency, and honest accounting. It is one thing to promise care. It is another to sustain it. There is also a deeper question, a philosophical one. When we speak of free healthcare, do we imagine a society that cherishes the health of its people, or one that outsources responsibility to a system? True health is not granted by governments alone. It is cultivated through awareness, prevention, and personal responsibility. A system that promises everything for free can sometimes erode the sense of shared responsibility that real health demands. Patients become passive recipients rather than active partners. The balance between compassion and accountability begins to tilt. This is not to argue against generosity, nor against universal care. It is a call for realism, the kind of realism that makes ideals achievable rather than rhetorical. For healthcare to be both accessible and excellent, it must be funded sustainably, managed efficiently, and driven by innovation. The word free should never mean careless or unsustainable. It should mean that the burden of illness is lifted fairly through a system that values both equity and excellence. Only then can we say that healthcare serves humanity, not just in principle, but in practice, not just in emotion, but in enduring truth. Access to healthcare is a noble goal, but access alone does not heal the sick. It is not enough to open the doors of hospitals and declare victory. True healing depends on what lies beyond those doors: the quality of the care, the competence of the professionals, the reliability of the equipment, and the integrity of the system itself. To say that everyone should have health care is right. To assume that mere access guarantees good outcomes is an illusion. The essence of medicine is not in its availability, but in its excellence. A patient who can see a doctor freely, but receives rushed or inadequate treatment, is not truly better off than one who cannot see a doctor at all. What we must seek, therefore, is not simply health care for all, but high-quality health care for all. In every society that has attempted to make health care universal, a paradox emerges. As access expands, the strain on the system increases. More patients, more demand, fewer resources per person. When the system is not carefully designed, quality suffers quietly, almost invisibly at first. Skilled doctors leave for better conditions elsewhere. Equipment grows outdated. Appointments stretch into months of waiting. The word universal begins to mean uniformly limited. This is not compassion fulfilled. It is compassion diluted. We must understand that the human body does not respond to policy. It responds to science, to precision, to care. When quality declines, it is the patient, the very person the policy was meant to protect, who pays the hidden price. There is also the question of trust. Patients must trust that the care they receive is not just available, but sound, that their doctors are supported, their medicines are genuine, their diagnoses are accurate. When a healthcare system prioritizes numbers over quality, that trust erodes. And when trust is lost, even free care becomes a hollow promise. People stop believing that the system will truly help them. They wait, they worry, they deteriorate. A healthcare system without quality is like a bridge built without steel, impressive in appearance, but fatally weak at its core. Quality requires investment in research, in education, in equipment, in time. It also requires accountability. Doctors must be able to work with dignity and focus, not buried under bureaucracy. Hospitals must have the means to upgrade, innovate, and attract talent. Patients deserve not just access, but assurance, the confidence that when they are treated well. This is what separates a humane system from a merely political one. In the end, it is not enough to make healthcare accessible. It must be worth accessing. Compassion without competence does not heal. The true test of a nation's healthcare is not how many people it admits, but how many it restores, fully, safely, and with dignity. Only when we preserve the quality of care can we claim that access has real meaning, and that our compassion has found its rightful form. Sustainability is the quiet foundation upon which every noble idea must stand. In medicine, where life itself depends on the constancy of care, sustainability is not a technical concern. It is a moral one. When a society promises free health care for all, it must confront a truth that is as unyielding as nature itself. No system can endure on goodwill alone. Without sustainable funding, clear priorities, and disciplined management, even the most compassionate systems begin to erode from within. They start strong, buoyed by vision and public applause, but over time they bend under the weight of expectations that exceed their means. What begins as a symbol of generosity can become a mechanism of quiet decline, where excellence is sacrificed to keep the promise alive. In in the laboratory, I learned that every experiment requires balance. Inputs must equal outputs, energy must be conserved, and the system must remain in equilibrium. The same law governs healthcare. If we consume more than we replenish, if we spend more than we invest, if we promise more than we can deliver, collapse is inevitable. This collapse is rarely sudden. It appears first in subtle forms: longer waiting times, overworked doctors, delayed maintenance, shortages of essential drugs. Then, one day, the entire structure trembles. Sustainability is the discipline that prevents this decay. It asks the difficult questions before the crisis arises. It forces us to consider not only what is desirable, but what is possible. Not only what feels right, but what endures. There is also an emotional cost to unsustainable systems. When a doctor cannot give the care they know their patient deserves because resources are scarce, a moral injury occurs. When a hospital must turn away patients or delay surgeries or ration life-saving treatments, it is not merely an administrative failure. It is a wound to the collective conscience. Sustainability protects both patient and practitioner from this kind of quiet despair. It ensures that compassion is not squandered, but structured, built into a system that can last for generations. Innovation plays a vital role in this. Medicine advances through discovery, not inertia. A sustainable healthcare system must invest continuously in research, technology, and education. It must reward efficiency without punishing empathy. It must adapt to changing populations, new diseases, and emerging challenges. If the system becomes rigid, resistant to reform, it will eventually collapse under its own generosity. Sustainability is not the enemy of compassion, it is its guarantor. We must learn to speak truthfully about cost, without shame or sentimentality. Every society must decide what it can provide freely, what it must subsidize, and what it must regulate. These are not cruel calculations. They are the mathematics of endurance. In the end, a healthcare system that survives, strong, ethical, adaptable, serves humanity far better than one that burns brightly and fades. Sustainability is not about limiting care. It is about ensuring that care never runs out. In closing, the promise of free healthcare sounds better than it is if free means ignored costs, diminished quality, hidden trade-offs. But if we redefine it to mean healthcare available without ruinous expense, delivered at high quality, sustained intelligently, then yes, we have something worth striving for. Let us turn the ideal of free into the reality of fair, excellent, sustainable. That is the commitment we owe to one another. Thank you.